So for the listeners, social prescribing, the newest definition at a high level, is a creation of a care plan based on what matters to the patient, which is shifting conversation from what's the matter with you to what matters to you.
Right.
So we're putting the patient at the center, and based on what are their most important goal, there's a dedicated person called the social prescribing link worker, or link worker for short, that get to spend that time with the patient to kind of understand the need, which could be like an hour conversation initially, and then follow-up conversation, which could be half an hour instead.
This podcast is for education and information purposes only. It is not a substitute for professional medical advice. Welcome to the Motherhood Clinic, a podcast about caring for mothers after childbirth, led by clinical experience and real-life stories. If you're a new mum and ever asked yourself, is what I'm going through normal? Should I be worried? Or who should I ask for help? Then this podcast is for you. It's for anyone navigating those early weeks, months, or even years after having a baby. Each episode brings together voices from across the motherhood journey, from clinicians, experts, and mothers from all walks of life. We're here to help you feel more empowered in your unique motherhood journey. We believe in a better start to motherhood.
Thank you so much for joining us on the Motherhood Clinic. Really excited to have you here. I was really excited to chat to you for a couple of reasons. First off, I don't think I've met anybody that is a pharmacist, an author, a dancer, and also does judo and quantum and Metaverse. I've got quite a few areas that we can connect together. So it's quite a unique interests and career that you've got.
Thank you.
But for the people listening, in particular those that are either expectant or new mothers, it really comes down to your focus in social prescribing. And from the conversations we've had with new mothers, we know that postnatal loneliness is a huge thing to deal with and can lead to other areas, whether it's anxiety or postpartum depression. And I think it'd be really interesting to hear about your journey, your interests, and the work that you're doing, both as a pharmacist, but also as a pioneer in social prescribing, and just talk about what is it, what's the value of it, what can listeners take from the conversation. So that's what I think would be great to do. Just to lay out the conversation for today, I've given it the title of What If Health Isn't Just About Medicine, but also about connection. So we'll talk about the problem that exists today around loneliness. We'll talk about what is social prescribing, and then we'll talk a bit about tools and guidance. But I'd love to hand over to you briefly and just give yourself a proper introduction and what you've done and what led you here today.
For sure. So my name is Arun. I'm a pharmacist working in GP practice. And I'm also a huge advocate when it comes to social prescribing application in the pharmacy sector. Quite passionate about quantum, Metaverse, but I guess from today's conversation, mainly social prescribing, but it's mainly from my dad's background that kind of enabled me to become more passionate about the application of social prescribing, not just in dancing, but also music, work to the museum, and many aspects, which kind of goes to the topic of social determinant of health. I'm also an NHS Clinical Entrepreneur, and I'm also a Mid and Southeast Essex Innovation Fellow.
If there was a profile of you, I think there'd be like 12 different profiles that you could put that make you up. But I think it's what makes it interesting, because you can connect the dots between so many different things, which may not have at first a common connection. But I think that's probably the value, that you can look at a problem from so many different angles.
Yes.
So let's begin on that first topic of what is the problem we're addressing in this space. We've spoken to many new mothers about what they go through in those early stages, and maybe continue on. After they've had the baby, we see there's this big social celebration. When we had our kids as well, everyone celebrates that, and it feels like you're part of something. But then it is also very individually isolating, and it's a very unique and personal journey. So there's that real contradiction that people face, and it might be, they may have faced that before. It might be the first time they face that as well, because it is such a, it's the first time they've had a baby, and it's the first time that they may have been on maternity leave. And, you're figuring these things out for yourself, and you're still figuring out what your views are and who you belong to, and those tribes, etc. So I just want to just talk a bit about that space and the problem that exists, and what's your What are you seeing at the moment?
Yeah, so far, I guess my first career in the pharmacy world was as a community pharmacist.
Yeah.
And back in 2013, there was a service called Medication Use Review, or MURs. Within that service, we would be expected to have a conversation with the patient that takes several medication, which kind of say how you're taking it, do you have any side effect, and any other question. And I vividly remember there's many occasions where we'll probably spend maybe 5 minutes talking to a patient, and the remainder of the time, which could be maybe 20 minutes, 30 minutes, it's just them talking about their life story.
Yeah.
And I was just listen, because I felt that they needed to unpack some of their story. And one of the comments I received from the patient is, you're the first person I got to speak properly like this in 3 months. And it kind of made me realize that senior citizens often come to the pharmacy as the first point of contact because they don't need an appointment. And often their children might be living away. And for them, we develop that rapport. That's why you have very strong bond between pharmacy in a city, especially in villages, and the patient community. From there on, I kind of carried that seed of trying to help other people. When I did dancing, more specifically crumb dance, it kind of allowed me to express myself, kind of improve my mental health, because it can be quite stressful working in community pharmacies. And then in 2015, I saw an article in the pharmaceutical journal that said exercise on prescription. And I immediately clicked saying, okay, if there's exercise on a prescription, why can't we have dance on prescription?
Yeah.
So I think at the time I kind of reached out to different organizations, including the Pharmacy Research UK. And they said, oh, Arun, if you want to do a study on dance on prescription, you have to do a PhD or you have to apply for funding.
Right.
I'm thinking in my head, I already spent like many years studying for a degree. I don't have the energy or time to spend under the 3 years doing a PhD specifically on dance on prescription. So I kind of parked it. But then coincidentally, I can't remember exactly when, but I saw an article on dance for Parkinson in 2015. And when I saw that, I said, that looks interesting. And then I did the course. It took me about a year because of other commitment with my dance career. And eventually when I completed it, during the program, I was able to do volunteering classes with patients with Parkinson. That was with a charity called Moving to Wellbeing. So I'm grateful for Donna, who kind of gave me the opportunity to be a volunteer. And eventually they allowed me to run my own classes. So I say one-off, which is very enlightening. I learned a lot. And then for me, that was almost like a bucket list. I'm a pharmacist and I delivered my first session as a dance for Parkinson practitioner. Then I said to myself, how can I take this gift of patient that has Parkinson, but when they do dance classes, they transform into a dancer where you no longer see them as a patient, but as a dancer. And that's when I was floating the idea that maybe I should kind of do some social media posts about it or not. But then on Facebook, there was an ad that said, write a book on your story. And that's when I clicked, or maybe I can write a book on the topic. And I did realize that writing a book on dancing or pharmacy would be difficult if it's just me, because in a pharmacy world, there's a lot of big names. I'm trying to get someone to write a book on the topic without having an academic background might be seen negatively. So I did a smart thing was to do interviews for my book instead. So I did interviews with dance for Parkinson practitioners that's done it for decades. Eventually, someone said to me, Arun, what you're doing is social prescribing. And I said, what do you mean? And he said, well, when you give dance classes to someone to improve their health and well-being, that could be seen as a form of social prescribing. Because the definition of social prescribing, which can come back to it in a moment, back in 2016, it was still seen as prescribing an activity, social prescribing. But now, I think in 2021, the definition changed. So I can say, okay, so dancing is social prescribing. And then eventually, it led me a path of writing a book, which got published in January 2018. Then I did an online course in collaboration with Dr. Maria Ann Essan called Social Prescribing for Community Pharmacy, which currently has, I think, 2,000 students from 100 countries or so. And then in 2021, I decided to organize a virtual conference called the Pharmacy Social Prescribing Conference. And then in 2022, I had the opportunity to have as a keynote speaker the father of social prescribing, the father of, I say father, it's more like grandfather, social determinant of health, called Professor Sir Michael Marmot, who wrote the book The Health Gap. After rebranding my association, which is really one-man army, in 2016, which is called the Movement Pharmacy Association, because I couldn't call it the Dance Pharmacy Association. That would be very narrow in my scope and number of reach. So I decided to call it movement as a movement of the body, the mind, and the spirit. And then in 2019, I rebranded Movement Pharmacy Association, PA to SPA, Social Prescribing Pharmacy Association. Then in 2022, I rebranded from SPA to iSPA, following the feedback from Tarek, who is a pharmacist from Canada, who's also pro-social prescribing. And then the core team is basically me, Tarek from Canada, Annie from Australia, and Adam in UK as well. I think I'm losing track of that initial question. What was it?
That's fine. No, well, it's really great just to hear. I think an important part of this conversation is your journey through this. Let's bring it back to, again, people listening in, because I hadn't come across the term social prescribing before. When you say prescription, I automatically think of, medicine and drugs. So that's why I wanted to really dig into that and understand the balance between when you have any kind of health issues, understanding, what you might go to a pharmacist for, you might think I'm going to get some medicine to treat that issue or that health issue.
Yeah.
Versus where we're going now, which is more, I guess, more holistic perspective in terms of how did that movement come about?
Yes.
Because that's not maybe what people might not expect to come away from a conversation with a pharmacist on, saying,
sure.
I prescribe you to go and do some dance lessons. That's not what I would have thought.
Yes.
So let's explore that a bit. And what I'd like for people to take away from this is understanding the different tools that can be used to treat these health challenges. So I'd love to look at that a bit more.
So in pharmacies, there is an initiative called the HLP, Healthy Living Pharmacies, which is positioning community pharmacy as not just a dispensing medication, but more as a health and well-being hub. And it's become mandated that every pharmacy in the country needs to have a healthy living champion.
Okay.
That has been upscaled in healthy living advice. For example, alcohol consumption, smoking cessation, blood pressure, dieting, exercise. And within the HLP framework, unfortunately, there isn't a national contract for pharmacists to be able to provide the social prescribing service. So for the listeners, social prescribing, the newest definition at a high level, is a creation of a care plan based on what matters to the patient, which is shifting conversation from what's the matter with you to what matters to you.
Right.
So we're putting the patient at the center, and based on what are their most important goal, there's a dedicated person called the social prescribing link worker, or link worker for short, that get to spend that time with the patient to kind of understand the need, which could be like an hour conversation initially, and then follow-up conversation, which could be half an hour instead. And the conversation is almost 3 to 6 months long. And then there was the work laid out by Dr. Michael Dixon with his GP practice, and also Bromley Bible Center in Bromley Bible, which kind of champion that social determinant of health should be at the forefront of the conversation. So in a nutshell, what it means is that someone's social condition can impact someone's health and well-being. And one of the powerful stories that was shared to me by Dr. Mary Ann Essam, she was saying that one of the patients was getting recurrent chest infection in the 80s, and the doctor just prescribed antibiotic. But then eventually a social prescribing link worker went to the patient's house and noticed that the window was broken.
Okay.
So because the window was broken, the patient was suffering from hypothermia, which means low body temperature, which was causing the chest infection.
Wow.
And then the link worker was able to get in touch with the housing association to then fix the windows. And as a result, the patient was no longer suffering from chest infection. But there's no way this would have been found out if it wasn't for the link worker going to the patient house.
Yeah.
And this could be extrapolated for many other things. For example, someone that might be unemployed is currently on universal credit. They may not be able to afford food that are healthy, which are contributing to the worsening of their diabetes or high blood pressure.
Yes.
Right. So for those people, they do need like a package in place to help them potentially with funds for food. But there's different organizations, charity available if needed. Similarly, someone that may have depression could be because someone passed away. So they're suffering from, they need bereavement support.
Yes.
But then there could be a case where, oh, if you're feeling depressed, hey, someone antidepressant.
Yeah.
But thankfully, the guideline has changed that when someone has depression, you've got to do some kind of questionnaire, because the PHQ-9,
Yeah.
I think Patient Health Questionnaire 9, and it kind of categorizes the depression from low, medium to moderate to severe. If it's low to medium, the NICE guideline, which is basically a recommendation that they adopt in GP surgery and hospital, they go with non-medicinal activities or support first before exploring medication. And then for the people that are more like very severe, then you go straight for medication, which is SSRI, like sertraline.
Yes. There's some really important points I wanted to pick up on what you just said. And there's some really important things. I appreciate the anecdotes as well. I guess the first thing is looking, what I feel you're describing is a more holistic perspective and understanding the root cause of someone's ailments.
Yes.
That's a great example of the guy, just a chest infection. And all you see as a pharmacist is chest infection. And then you treat that with, a drug or medicine, when in fact the root cause is so much simpler than that. Now, obviously, there are reasons why that happens. And there are reasons as to, again, we need to invest the right time and support and the right systems in place in order to do that. I really like the point, just that simple phrasing of what's the matter with you versus what matters to you. So I'd love to rest on that a moment. And one reflection I had is, if you said to me, let's talk about what matters to you, is some people may not know what matters to them. And that's a journey in itself to figure out what does matter to you. It sounds like personally, you've got a whole array of things that you can pick on, but other people may not have that. So my question is, if we can agree that finding what matters to you is important and can open up a whole different avenue, potentially non-medical, to really help you live in life and live in line with your values, how do we help people figure out what matters to them?
So the beauty of it is GPs only have 10 minutes per appointment, give or take. And within that 10 minutes time frame, they haven't got the time or bandwidth to listen to the whole patient journey or story. They come in with a medical condition. Okay, you got a cough. How long I did for? Do some history taking. Here's some medication. But now that social prescribing is part of the NHS contract since 2019, from understanding, we do have resource allocated to hire social prescribing worker. During the conversation with the patient, if they found out that they start to discuss about non-medical issues, saying, "Hi, doctor, I lost my house recently," or this happens, actually, what do you think if I put you in touch with the social prescribing link worker, which is part of the NHS team? And they might say, what's social prescribing link worker? That's when the GP or myself as a pharmacist can explain to the patient. And I think 9 out of 10, the answer is, wow, I didn't know that existed. Yes, please.
Yeah.
And the 1 out of 10 that says no is because they have social anxiety around people coming to their house.
Right.
Or social phobia or agoraphobia. I think one of them would.
Yeah.
So for them, they don't want to speak to anyone, even if given the option. But for those that don't mind speaking to people, but were not aware of this service, they really enjoy it.
Yeah. So that's also important for anyone listening in, is to ensure that you as the patient are disclosing not just one dimension of your condition, but as you said, actually a holistic picture, because you as the listener can only pick up on, unless you're actively asking me on a wider range, but I might only be giving you one dimension of my condition. How much do you ask me that allows you to understand me as a whole person? And how comfortable do I feel as the individual telling you everything else that I feel doesn't really concern you? So to bring this back to, a specific example, Our first guest on the podcast was Charlotte Brown, and she had a very difficult time in the pregnancy, but she got very sick. She had HG. And so she was learning to self-advocate for herself. She acknowledged that maybe she was only giving she was only saying certain things to the doctor, and almost sometimes downplaying her symptoms. But she felt that had she maybe told more and maybe provided more information, they might have potentially come to a different conclusion. My take home from what you've just said is, as the patient, ensuring that we give the medical advisor the full picture and allow them to come to that conversation, I think is important.
And I think that that's a good segue on why I'm quite a huge advocate of ambient scribing.
Ambient scribing.
Because a lot of the time when I speak to patient, it's done on the phone, which is fine. So I can just type it off. Then for some patient, it's face-to-face.
Yeah.
And often I have to break eye contact when I'm talking to them to type it off. And the fact that with ambient scribing, I can just talk to them and then it gets recorded and then gets summarized for me, it allows me to kind of keep that human connection more frequently than without the technology, if that makes sense.
Yeah, it does. It does. There's also a point in here where I think there'll be different personas coming into this conversation. So let's take me, for example. I try not to take any medicine. I prefer to, so I would be all for social prescribing. And I'd say, if you can tell me that another route is available, I'll be like, that's great. There'll also be other people who would actually want the medical route. And there's obviously a line in there somewhere where you're saying a specific health condition, you're going to have people that may or may not want to have a medical intervention, or may want to have a more social. And how do you want to identify that? When is a challenge medical versus not? And how much do we account for when we talk about self-advocacy, right, for patients? And how much is within their control to say, this is what I want as well? And what is that interplay between you as the advisor and the expert in this space versus the patient as like, well, I want to have control over what is it I want? What does that dynamic look like? And are there any helpful pointers?
So when it comes to consultation, we use something called the Calgary, I can't pronounce the full thing, but it's called Calgary mode or something, and kind of had a nice structure to it. But one of them is called the golden minute,
where
you let the patient talk like a minute, just listening to the story. And from that 1 minute, you're able to pick up so many information and social cues, not social cues, sorry, I mean the body cues, micro expression, to see which part of the story is what probing for more information.
Okay.
And there's a concept of shared decision making.
Okay.
Which means that every patient have different needs. So as part of social prescribing, there's also the personalized care model. And within that, they say, I think 90% of the population can have easily social prescribing, but the 5% need more special needs. Specialized needs, sorry. So for example, someone that has pre-diabetes, means that they don't have diabetes, but at risk of developing diabetes, there is a program called Prevent, which is a government initiative to help educate the patient on diabetes and help to potentially reduce the risk for them to get to that stage. Then beyond the pre-diabetes stage, there is the diabetes diagnosis, and some of the program is called Desmond, which is again a government initiative, or NHS initiative. And within that, it's not just about medication, it's about medication, cooking, exercise. It's more like education for the patient.
Okay.
So it's like a 360. So you're still in the medication, of course, but you do need to change your behavior around your condition to improve your art of have a better control of your medication and your medical condition. And same for COPD, chronic obstructive pulmonary disease. When someone does smoke in the 70s, often when they have the COPD diagnosis, even though they're in increased risk of having lung cancer, it's hard for them to give up. So what we do at the NHS level is we give them inhaler that's stronger and more frequently. And within that category, there is something called the MRC score, which basically means how far can they walk before they start feeling breathless. And anyone that has a score of 3 and above, they're eligible for what we call preliminary rehab. And basically gentle exercise to improve the mobility and the ability to breathe better with COPD. So for preliminary rehab, it's nothing to do with medication, but still exercise based.
Yeah.
So every medical condition has some kind of component which is holistic, but it depends on the patient's medical condition, because one person could have just diabetes, but another person could have diabetes, asthma, COPD, depression, hypertension. So we call them multi-comorbidity patient.
Yes.
So it's much more complex.
Yes. No, I understand. There's a lot
So it's
there.
like shared decision making, right?
Yeah, of course. And can we talk about the benefits and the impact that you've seen? Because again, there could be an assumption amongst many others, which is say, well, I want to have the medicine because it's proven, and I know, like 9 times out of 10, if I take paracetamol, it's going to help my headache.
Yes.
For any of those skeptics out there, what's been the impact and the value of different social prescribing methods in addressing these health ailments, to really show the power of it?
Yes, of course. I mean, I think there's the term return of investment.
Yeah.
And there's another thing called social return of investment. And I think there was a study done by one of the university, I think it was Westminster, I could be wrong, which showed that for every pound spent on a social prescribing intervention, get, I think, £3 back or £10 back. I can't remember exactly the figure.
Yeah.
And it's been shown that people that benefit from a social prescribing intervention has reduced admission to the hospital and reduced number of visits to the GP. That's because for some patients, they might be lonely. Therefore, that interaction with the GP is an opportunity for them to talk to someone. And it got so bad that they even have a minister of loneliness in UK.
A minister of loneliness?
When I checked a few years back. I haven't checked who is the current minister.
Yeah.
But even there's a study published by the World Health Organization on social isolation.
Well, okay.
So it's an epidemic, literally.
Do you think it's got worse?
100% with the COVID, with the digital tool that's making people more apathetic to other people.
Yeah.
And the fact that many people tend to rely, not many people, I think the younger generation or the teenagers tend to put a lot of their self-worth on the number of followers or likes they have, when really what they really need is like a strong circle of friends.
Yeah.
But then you have the media, the TikTok reels, Instagram reels, TV shows, Netflix, that shows the more people you have around you, that means you're successful. Therefore, you should be happy.
Yes.
But then there's a category of introvert versus extrovert. And sometimes when they see that on external medium, they think that's normal, when really it's not.
Yes.
So they get associated with the wrong values around being happy.
Yes.
So definitely, yes, it got worse.
Yeah. Because I guess where I'm going with the reflection is, or I bring this back to a postnatal period where what we observe is it can be a very lonely period. It is a very new period. You might have had bouts of loneliness previously, but this is your first time also with a baby. And the one thing, you have when you just have given birth is you've got the baby and you've got your phone, right? Because that's your lifeline.
Yeah.
But then, if I remember how my wife is like, you're not only looking on Amazon for the next baby pillow and what's coming next, but you're filling that time with social media, and you also want to present that. So, you have those two dynamics hand in hand.
Yeah.
And when do you feel ready? And everyone will have a different time period to then reconnect with people. And who do you have around you in that support network? So it's more just, I think, a reflection on the dynamics at play that lend themselves to people being lonely. But then what is it people can do if we've seen the value of social prescribing, and we know that and everyone inherently knows that to have a deeper connection, the quality of the connection as opposed to the volume of connections is what's valuable. I guess my question is, how do we nurture people that are going through that might know that rationally?
Yes.
How do they start to work their way up towards that? And are there, you mentioned the link workers, that the work that they do, and there might be certain things that they're doing that help to unearth that. But is there any practical advice that you might give to someone that is maybe going through a period of intense loneliness, having just given birth, they may or may not be an extrovert or introvert. Are there any practical things that you've seen from the social prescribing framework or principles that, you would suggest?
I mean, if I was to speak to a woman that just gave birth and say, I do feel low,
Yeah.
I will almost instinctively ask them, would you be interested for a social prescribing referral? And the first question, like, what's social prescribing? Then I tell them it's like a care plan based on what matters to you. So you mentioned feeling lonely. So it's be able to create a care plan which can include things you like to do, which allow you to connect with other people.
Yeah.
And it's free. You don't have to pay anything. It's part of the NHS. So when I say it's free, it's part of the NHS, it kind of make them more willing to accept that offer. So I guess for the listeners that are not familiar with social prescribing, if you were to type social prescribing and the name of your city, every city have a social prescribing division or organization. The way it works, either you can self-refer, so you don't have to go to your GP to access to a link worker, or if not, they may ask you to speak to your GP to then be referred to a link worker. Self-refer versus through the GP route. And then from there on, once you have the conversation with the link worker, they'll be able to connect you with what we call community asset, which is basically location within the community can be used for something useful. For example, the gym classes, the dance classes, the museum, the park. And they'll be able to let you know services potentially to support other women in a similar situation.
Great.
Because the GP hasn't got the bandwidth to look at every single organization in a city which is near to the patient, but the link worker can.
Great. So what we can probably do after this is we can provide the details in the episode description for people that want to access, social prescribing through the NHS and what they can do. So that would be really helpful because, again, I think many people may not have heard of that or be aware of. And I guess so many of these services that are available in NHS or privately, people don't even know they exist.
Exactly. Yeah.
And that's probably the biggest thing that I hope with the podcast and these conversations, people are just aware that these things even exist.
Exactly.
Right. So that would be great. I'll make sure that it goes out. And the final area that I wanted to touch on a bit, I was personally curious as well. So when we talk about tools and guidance, we've talked about like the link worker, which is the physical support, right? You come in and, someone is there to speak to you. You're that person, maybe after 3 months, you haven't spoken to someone. So there's a very physical, and I think when I think about communities and I think about social, I think physical connections, right? And, the quality connection and being physical. But you also have a lot of work that you're doing in the metaverse and with AI and stuff like that, which I just happened to pique my curiosity. And we did speak on a previous episode with Michelle Frank, who's developing digital communities for women. And I just wanted to explore a bit of the role of physical and digital, and what is the opportunity for people that may prefer to engage online. And can that, although that is part of the problem, can that also be part of the solution? And are there things that you're working on or things that you're aware of there that might be of interest as well?
So I did wrote an article on Metaverse social prescribing.
What is that? What is that?
So basically, when you think of social prescribing, it's mainly, so maybe let's take a step back. So how would we define the Metaverse? And the Metaverse has quite different definition, but if I had to summarize in a high level, is the blending of physical and digital, which is interconnected in real time and persistent. So for example, right now we're talking face to face, but then the concept of Metaverse could be that I could be here, but then you could be in a different location. And we can even go beyond that where I could be, for example, in France, talking to someone in Japan. At the moment, the Metaverse, many people think that it's like 3D, but it's not. The Metaverse is the definition of persistent world, but the medium that you choose to access it can be through your mobile phone, through your computer, or via headset.
Okay.
So you're choosing a level of immersion.
Right.
But as long as I'm talking to someone in real time that's persistent, that's the definition of Metaverse. Now coming back to the example where in France, I'm talking to someone in Japan, I could be wearing a VR headset or smart glasses where I could be talking to the person, and then I could be wearing some haptic gloves or something.
Yes.
Or I could potentially do a handshake
Mm.
and feel the vibration to my hand. So it almost, I guess, unless you wear a VR headset, it's going to be very hard to describe that feeling, because when I was wearing a VR headset, I think it was the Oculus Quest 2 or something, I was using Old Space VR. And for people that know what's Old Space, basically a Microsoft environment as a metaverse kind of thing. And the graphic was very 2D.
Yeah.
Not 2D, but like very cartoonish graphic.
Yeah.
And even though it's cartoonish graphic, because I had my VR headset on, it felt real to me. And I think the best way I can describe it is, once the provenance of AR glasses becomes more part of a natural routine, similar to mobile phone that now become more like our day to day, then talking to someone using AR glasses, talking, shaking the hand, when someone look at you, to like shaking the hand to no one, but for you talking to someone and shaking the hand, it becomes real and becomes more easier. Not exploiting that to community asset. So a community asset could be that instead of you physically going to your location to access to dance classes or music classes or gardening, you putting on smart glasses.
Yes.
Then instantly, in the comfort of your own home, you're surrounded by 10 people doing gardening. And the gardening could be actual gardening, or it could be digital gardening.
Yeah.
But you're talking to someone like it's real. So you maintain that social connection, but digitally.
Yeah.
And same for dance classes, same for music classes, same way walk to the park.
Yeah.
But instead of, and this kind of opens up the opportunity for people that could be wheelchair bound.
Yes.
So they may not have the opportunity to travel to a different location. Instead, you can do it at the comfort of their own home.
Yes.
And still being able to maintain the social connectedness.
Yeah. And that's really relevant, I think, particularly for new mothers, where you may have several reasons why you don't want to leave your house.
Yeah.
Whether it's because you've got a newborn, whether you're not in the right physical condition, you're not ready to meet people. And if the promise is that you can still deliver an element of social prescription value and impact to someone that doesn't have to leave their home, I think that could be huge.
Yes.
Because that's such a relevant use case. I'm sure, as you mentioned, obviously wheelchair users as well, but to gain that, to overcome that barrier of physicality and proximity, but to emulate that, I think would be huge. So I think that's a really exciting space, which I'm sure hopefully will develop it's developing, and we'll see what that looks like.
Yeah.
But real Star Trek holodeck type stuff, isn't it? Right?
Yeah, that's right.
But I think that's very promising. Do you see that coming into fruition? Where are we in that maturity? Are we like, do you have a perspective? Are we like 5 years away, 10 years away, 20 years away from that becoming something that we might start to see? Do you see?
So I think the metaverse hype came about when Facebook rebranded to Meta, which I think was 2022. So a lot of money was poured into the metaverse industry.
Yes.
For example, every major company started to come up with their own VR headset, VR glasses. But then when ChatGPT came about, people were like, well, either we can start investing in the metaverse, or redirect our fund to the AI race towards artificial general intelligence. So all the money right now is being poured into AI, because that's where the biggest money is, because the first person to reach the stage of AGI would be able to dominate the market. There's also a lot of money being poured in quantum.
Yes.
Because computers have become more and more better, and also advanced quantum computers getting to a stage where there's more funding available from investors to quantum computing startup. Then you have 3D printing. Then you have robotics. So basically, as a convergence of technology that's going to enable the metaverse to become almost part of our daily lives.
Yeah.
And I foresee that potentially, if lucky, 2035 or so.
Okay.
Or 2040. Because think about it, right now in 2025, but if you were to go back in time by around 35 years, when the internet was still young, nobody would have predicted you'd be able to watch TV
Absolutely
on a tiny screen. It's like almost magical.
Yes.
So I can't even imagine how far technology will go in the next 10 years,
Yes.
not even 35, 10 years, because there is this loop with AI kind of exponentially increase the rate of innovation.
Yes. Yes. That could be a whole other conversation. But this has been really helpful. Thank you again. I wanted to bring all this back then, talking about, we've picked on one area that you're an authority on, and pressure. There are 10 others that you could be obviously a conversation on. One question I tend to end with each of our guests is, we at the Motherhood Clinic, a big part of what we talk about is a better start to motherhood. And that can mean a lot of different things to a lot of different people. So if I were to ask you, what does a better start to motherhood look like for you, or for your partner? What does that mean to you in the context of this conversation or outside of that?
So I guess it was quite helpful that when me and my wife had our first baby, we'd taken part to the class called NCT class, National Childbirth Trust. And the fact we got to meet other couple in a similar situation, it almost created a bond,
Yes.
which we still have till this date. So I think even my wife got a WhatsApp group with all the mothers,
Yeah.
and they kind of exchanges, like often meet up every year or a few times.
Yeah.
We get invited to other birthday party of the babies. So I guess joining organization early on during the pregnancy, number one, I live with the fears and anxiety around childbirth and the option available. And then after giving birth, you have that circle of mothers that went through a similar journey, and you can have their social circle to talk about anything.
Yes.
For men, I guess we're less talkative than women. I mean, she did ask me, "Oh, do you want to be part of WhatsApp?" I'm like,
yeah, of course.
but yeah.
Aaron, thank you so much.
Thank
This
you
has
for
been a
the
really
opportunity.
helpful chat. Again, there's loads of conversation I'd love to have with you, but this has been really helpful. So thank you again for your time.
Oh, thank you.
Thanks, Aaron.